Joining us now is the commissioner of the FDA, Dr. Stephen Hahn. And Dr. Hahn, thank you for being with us today, sir.
Mr. Fredericks, thank you very much, and my best to the people of Virginia and all your listeners.
Hey, Dr. Hahn, please call me John. The only people that call me Mr. Fredericks are my son's friends when they think I'm mad at him. So don't do that. All right, now, let's get to the FDA. A couple of things immediately. What is your involvement on the task force with the president and the vice president, Dr. Hahn? Just describe to us how you're involved in that.
So I'm representing FDA, and FDA's role is to help facilitate the development of testing procedures, so therapeutics or treatments for COVID-19, as well as the protective equipment that folks are using in the hospitals to protect against infection. So our job is to look at those and assess their safety and their effectiveness. And so on the task force, what we've done is we've provided advice and support. For example, as FEMA and the White House and HHS, Health and Human Services, put together supplies for much of the country, we provided technical support about those so that we can say, yeah, these respirators protect people from infection. These therapies look promising. We're going to put them into the country to have them be tested. So those are the sort of things we're doing. And I just want to take a moment, John, to just praise the leadership of the president and the vice president. They have just done a terrific job to help lead this effort.
Hey, look, Dr. Hahn, I really appreciate that. I mean, I look at the president every day, the vice president, they have a press conference every day. Last night it went on for 2 hours. I mean, I told the story, I put it on, I watched, the first 30 minutes. I had to go pick up our dinner for the family at Curbside Takeout. I went, I picked it up, came back. He was still on, caught a little bit of that. Something was missing, got back in my car, went back, got it again, came back. It was still 2 hours. I don't know what you could do more than the president, the vice president, and this task force, and I know how hard, sir, people are working. FDA, one of the things the president said is, look, we have to accelerate the approval for the testing. I think we've done that. He said there's a test out now that you guys have signed off on for implementation that basically in 15 seconds it'll say if you're negative and maybe in 5 minutes to get perhaps negative results. Or can you walk us through that quickly?
Yeah, you bet. Quickly. So this is a point-of-care test, and it gives you a result if it's a positive in 5 minutes and negative in 15. These are the sort of things that people go to the doctors for when they want to be tested for the flu and strep. And John, with respect to acceleration, the president has, in fact, asked us to do that. Let me give you an example on this test. This test normally takes 9 to 12 months to develop. In collaboration with the manufacturer, this test was developed in collaboration with the manufacturer over a 4 to 6 week period. So this is unprecedented and just amazing American ingenuity in the private sector working with government.
All right, Dr. Hahn, work that you're doing in the FDA, the Federal Drug Administration, the work that you're doing supporting drugs and vaccine to fight this virus. Tell us about the utilization of chloroquine. I'm not sure how to say it.
You got it.
Chloroquine, right? I'm getting there. But the common drug that was utilized to fight malaria for so long, a lot of people saying that they've had success with it. Dr. Fauci saying, we don't have enough information. Where's the FDA on this?
The FDA is always going to be in support of gathering more information that lets us to make a decision about its safety and effectiveness. So we don't have the information we need right now. There are some encouraging preliminary reports of its use. So the way that it's available now is, one, in a clinical trial, but secondly, it's available if a doctor wants to prescribe it, because this drug has been approved for other diseases by FDA in the past. So not approved for COVID-19, but available for a doctor to prescribe. So there are multiple ways that this could be given to someone. It's really important that this be done in a doctor-patient relationship, because all drugs have side effects, and it's best done as a doctor who knows a patient and understands what medications they're on and other diseases they have.
We're with Dr. Hahn. He's the FDA commissioner, also part of the President Trump, Vice President Pence Corona Task Force. Dr. Hahn, tell us about the use of blood products to help treat infected individuals. Where are we with that?
Yeah, I'm really excited about this one, John. So what this basically is taking plasma, which is the liquid part of blood, and it contains all the antibodies, the immune-fighting proteins against an infectious agent, so like COVID-19. What you do is you take that from someone who's recovered from the virus. You take that, you remove any virus that might be present, and then you give it to someone who has the actual illness. And what you're doing is you're transferring the immune fighting of the one person who's recovered from it to the other person who's currently fighting it. There are some preliminary reports of the effectiveness of this. It's called convalescent plasma, and I think it holds great promise for us. Of course, folks have to recover from the virus in order to gather the plasma. But as of last week, a week ago, we put together what's called a compassionate use program and gave guidance to hospitals on how they could deliver this. And it required some manufacturing that's specialized. And what we'll have later in the week and early next week is a nationwide program. It's basically, we call it expanded access, where the Red Cross will help us collect these units of plasma to give around the country, and it'll give us a nationwide distribution effort. And so I'm really excited because I think that the data and the information behind this are pretty compelling. And we'll be studying this as well just to make sure that we have the information that allows us to state to the American people whether it's safe and effective. But I think it shows great promise and something that we're doing right now.
Dr. Hahn, how would you gather the plasma?
Yeah, so right now it can be done at a blood bank in a hospital, for example, some specialized hospitals who have the capacity. But really, if one is identified as someone who's recovered from the COVID-19, what our plan is for them to be able to go to the local Red Cross or a blood bank and be able to donate the blood, similar to what they do right now. So it'd be a very simple one-stop shopping with respect to that. And as this program ramps up, we could sure use the help in terms of advertising so that those who've recovered can donate and benefit those who are currently sick.
I know you don't do this, but tell your PR people, you guys would need to put a PSA on that, like out immediately, because we've got people that have recovered now. So basically, Dr. Hahn, we're with FDA Commissioner Dr. Stephen Hahn. What you're saying, Dr. Hahn, is that if someone has tested positive for the coronavirus, COVID-19, and they've recovered, which I think the average is about 1 to 3 weeks, right, for about 99%,
Correct.
1 to 3 weeks. So you've recovered. What you then want to be able to do is have that individual who has recovered go to the local blood bank operation like the Red Cross or the local hospital, wherever they go, donate that blood as a COVID-19 recovery person, and then you're going to utilize that in order to fight the spread of the virus.
That's right, and we're setting that program up now. It's in several hospitals around the country, but the nationwide program we're setting up. So your idea, John, about a PSA and other ways of communicating this is a good one, and we will do that as we set up this program. So stay tuned on that one.
And as far as the malaria drug, that is still being tested. There's some success with it, I know. They're testing it in New York City now. So I think what I've heard you say is that drug is already approved by the FDA for fighting other problems like malaria, so it's available and approved by the FDA. But whether or not it's a long-term problem solver for the virus, we still don't know.
We still don't know. Again, encouraging information, but we still don't know definitively about this. And, one of our promises from FDA to the American people is that we're going to use the science and the data behind this to actually make the decision. We don't want people to be taking anything that's not been proven completely that it's a benefit. However, in the case of hydroxychloroquine, because of the information that's currently available, that is a decision that an individual doctor could make with an individual patient because, as you state, it is available.
Right, so any doctor, any physician, personal care could make that decision. Now, Dr. Hahn, we're running out of time. Final question. You're part of the task force. You guys are meeting every day. President Trump yesterday saying you guys are working 18, 20 hours a day without any sleep. How would you rate President Trump's leadership in this crisis, Dr. Hahn?
He gets an A+. I've been very impressed. He has pushed us. He has asked us to help accelerate diagnostics and tests and treatments for the American people. He has provided great leadership, and I have to tell you, I 100% support what he's done to date.
Dr. Stephen Hahn, I want to thank you for being with us, FDA Commissioner in the United States and part of the Vice President Trump Coronavirus Task Force. Dr. Hahn, thank you for sharing that and for being with us today.
Thank you, John. Take care.